This week on the Nurse Coach Duo, we're sitting down with nurse practitioner and functional medicine provider Michelle Wallweber. She's the founder of the Drip Factor and Westplex Integrative Healthcare in Lake St. Louis, Missouri. Michelle is on a mission to help people uncover the missing pieces of their health puzzle with a special focus on what she calls the real epidemic in America, metabolic dysfunction. She's passionate around helping people connect the dots, understand the root causes behind their symptoms, and shift from reactive model of care to a proactive model. She blends the best of both worlds, conventional and functional medicine, offering a whole person root cause approach that emphasizes long-term wellness over quick fixes. Michelle believes in treating the whole person, not chasing symptoms, and values shared decision making with her clients and personalized care. In this episode, we're diving into a hot topic, GLP-1s, where we will unpack the real benefit of GLP-1s and how they work beyond weight loss, what's myth and what's fact, why GLP-1s are not a one-size-fits-all, considerations around dosing, side effects, safe sourcing, and trusting your provider. We discuss how menopause hormone therapy and GLP-1s can work together and the non-negotiable lifestyle shifts that must accompany this medication. Lastly, we discuss how GLP-1s can be a tool, not a magic bullet. Michelle's passion is clear. She's here to help people feel better, live better, and take ownership of their long-term health through whole life wellness. And she's a perfect fit for the Nurse Coach Duo. If you're on a GLP-1, thinking of it, or just curious, this episode has something for you. Before we dive in, just a quick reminder. This episode is for educational purposes only and isn't medical advice. If you're dealing with a health issue, please check in with your healthcare provider.
Welcome to the Nurse Coach Duo. My name is Angie McGuire with Coach Angie.
And hi, I'm Jen Schroer with Clarity Health and Wellness Coaching. And today we have Michelle Wallweber with us, and we're super excited. Thank you for joining us.
Thank you so much for having me. It's really my pleasure.
Yeah, absolutely. So Michelle we're really excited to have you because you're yet one more nurse out there helping the women in midlife, not just sitting at the bedside in a hospital where a lot of people think us nurses are. We are out there and doing so much more. So we wanted to introduce you and your business, Westplex Integrative Healthcare, and bring you in to kind of talk to us a little bit about GLP-1s, right? So we're hearing about this everywhere right now, and there's a lot of different things that people think about GLP-1s. And right now in the hormone world or the menopause world, where Angie and I spend a lot of our times, there's a lot of people talking about combining the two. So that's kind of what we're wanting to talk to you about. But let's start out with just if you can tell us a little bit about your functional medicine practice and how you work with women in midlife.
Sure. So I actually started 3 years ago as an RN while I was working on obtaining my family nurse practitioner degree. So quickly pivoted as soon as I finished, started Westplex Integrative Healthcare. And I think we all kind of land here because of our own pain to purpose story, and mine's no different. But when I started Westplex, I thought I'd be this super generalist to know everything about everything. And, that's really a lot of expectations, high expectation on myself. But what happened was not by design, but by calling. I think although I still see a wide range of ages and people, I've really dialed in on perimenopausal, menopausal women because that's my era. That's where I'm at. I'm a 54-year-old woman dealing with perimenopause and aging parents and kids and business and work and stress and all the things that everyone in my circle is dealing with at the same time. So I wanted to know how I could best optimize my own health, replenish my hormones, do everything to take care of myself. And so why wouldn't I want to do that for everyone around me?
Welcome to the Nurse Coach Duo. My name is Angie McGuire with Coach Angie.
And hi, I'm Jen Schroer with.
That's great. So I guess just back up a little bit, as for the nurses listening out there, our subscribers. How did you so you started as an RN? Did you work at the bedside? Did you work in and then you're a family nurse practitioner? you started your own practice, but
Yeah.
like, how did you get
Yeah.
from, how did you decide to go into functional medicine?
Yeah. So I've actually been a nurse for 25 years. I started my career in the emergency room at Children's Hospital, then moved on to an infectious disease practice, infusion center, and rheumatology, then infectious disease. Ended up getting my master's in nursing education and teaching for a little while. And it was there. It was during 2020. It was during, that time where all of us go, what are we doing? And it made us rethink everything that we know about traditional medicine. My collaborating physician said it perfectly. She said, it's like waking up and finding out that Santa Claus isn't real. And so in that moment, I knew I needed to be a part of changing the paradigm of healthcare. And I started initially, my business was originally called Drip Factor and it specialized strictly in IV vitamin therapy. And I was able to do that as an RN by having a collaborative physician. And that was it. That was my scope. But I knew that's not all I ever wanted. So I went back to school again, got my nurse practitioner in family medicine. And so that was by design. That whole plan was, I'm getting out of this. I'm doing something that can help everyone I know and love and those around me. St. Charles County wasn't offering much of anything in the way of IV therapy, much less functional medicine. And what did exist was in Chesterfield and Clayton and expensive things, expensive programs, doctors that you can't get into. So it was really limited and cost prohibitive, sorry, for a lot of us.
Mhm.
Yeah, the cost is ridiculous. You're right. And so you've mentioned just a couple things that just one thing that I want to just make sure we point out is that Michelle is here in St. Louis. Angie is in Illinois. So, but just in case somebody's listening and is like, where's St. Charles
Yeah.
County?
Yeah, I'm in
Yeah.
St. Charles County.
Yeah, absolutely. And so, and I know you offer a lot of different things. So you already kind of mentioned into the IV drips and everything. So what made you decide to go into the GLP-1s and the weight loss realm of things?
Because I saw the benefit. I heard about the benefit. I think it's demonized by a lot of people, a lot of influential people that we look up to, and I think that's because they don't fully understand the mechanism behind the way it works. And if you look at the long-term research that's finally coming out, I mean, these aren't new peptides, right? They've been around. Semaglutide has been around for 10, 15 years, originally designed to be used in type 2 diabetics to help regulate blood sugar. Tirzepatide was the next one following, added on an additional peptide. So it's a dual action peptide. We now have retatrutide coming out, which is a tripeptide. But I think immediately the media got a hold of, oh my goodness, these people are losing massive amounts of weight and they look like melting candles and Ozempic face and all these other things, which can be true. But when used correctly and monitored well and approaching it from addressing the whole person and not just them as a weight loss subject, it can be done successfully, offering long-term protective effects, neurocognitive protection, cardiovascular protection. I've used it in a patient with kidney disease that, along with other tools, we were able to reverse that. So there's tons of benefit when used the right way.
Yeah, I'm so happy that we're like talking about this as looking at someone as the big picture, the whole picture, and of course that is functional medicine, right? And looking at it more holistically. And but I do think GLP-1s have gotten a bad name, and the history isn't out there for people. And you've already said it; they've been out for a long time, and there's more to come, and they're not going away, right? And
Right.
this is why I'm so happy to have this conversation. And so when you approach, I know Jen already mentioned that you have a special approach or, a more unique approach with your patients in midlife. So how do you prescribe or how do you support or even how do you start the process? Because I think that's, it's on everyone's mind because it's in the news. It's, wondering what it can do and all the benefits. So I guess the first question is like, in the initial sort of approach of yours?
Yeah, yeah. So I think the main difference is I'm not a weight loss clinic. I am integrative healthcare, which means combining the best of traditional medicine with a personalized functional approach, really, really identifying root causes. So not a lot of people are coming to me going, I just want to lose weight and nothing else. I mean, it's common sense, right? We have to approach the whole person from all angles. We know that busted metabolic health is driven by inflammation, so we have to address that. We are living in, an era of toxin overload. What toxins are playing a role in that? We are stressed out. We're driving our HPA axis into the ground, cardiometabolic health into the ground with stress and lifestyle. So, we have to address that too. Gut health plays a critical role in nutrient absorption, which is huge when we're talking about putting someone on a GLP-1, because inevitably it leads to caloric restriction, but it's so much more than just about that. Gut health, immune function, toxic lifestyle. And is this a person perimenopause? Are they losing estrogen while they're also developing insulin resistance and wanting to lose weight? So I feel like this is common sense. I'm not just going to have somebody walk in as a new patient and say, okay, well, let's just start you off on this super pharmacological dose of tirzepatide and good luck, see you later. And then they're coming in wondering why they can't lose weight when we never addressed all of the other issues that go along with that. So I do take a very conservative approach. I never want anyone to lose too much weight too quickly. That's really important to me. People get, we live in this immediate gratification world and we all want to lose 10 pounds overnight. That doesn't happen, nor do I want it to happen.
Right.
Yeah, I mean, Michelle, I was definitely in that camp of against it when I first started hearing it just being used so rapidly and with everyone, and people are losing tons and tons of weight, and it's just like this one dose, right? This one, like, oh, you came in, everybody gets this dose. And when I had heard some different podcasts and stuff about microdosing, but I haven't found anybody who was even thinking about it. So when I met you and I started talking to you about it, I was like, okay, I felt like, oh wow, she's actually doing it the right way, the way that sounds like, you're taking each person into consideration. You're not just trying to, drop hundreds and hundreds of pounds off of people and send them on their way. And I know we talked quite a bit about, that lifestyle is definitely part of this. You can't just take this drug and think that, oh, as I lose weight, that's all that matters, right? So we still have to do our nutrition and maintain our muscle, because weight loss, when you're losing weight, there's a big percentage of that's muscle loss. So how do you manage kind of those lifestyle factors that fall into, you're on a GLP-1 now? Now, it sounds like a lot of your clients are not only for that, because like you said, you're not a weight loss office, but like, how do you kind of manage the conversations with these clients to say, this is more than just a shot and done?
Yeah. Well, thank you for acknowledging that. I appreciate that, because this is not a one size fits all approach. And unfortunately, that's what a lot of the weight loss clinics do is tirzepatide starting dose is 2.5 milligrams. So we're going to start you there. And once you stall out, we're going to bump you up to 5 milligrams. And often these people cannot handle these big giant doses and they can't eat and they're puking and they feel terrible. And it's because those, we don't constantly have that level of, we have GLP-1 in our gut, but we're not used to levels that high. I don't want side effects from any of my patients, nor do I have any. Maybe 1% of my population might have a little nausea or something every once in a while, but the way I approach it mitigates the nausea and the vomiting and the wiped out appetite, and they can't poop. So, and then they're caught in this vicious circle. So lifestyle factors, we have to focus on metabolic health. This is a lifestyle transformation. I recently had a gentleman come in. He's lost about 70 pounds over the last year with a weight loss clinic. And he came to me and said, okay, I'm at my goal. I want to go off this. Do I just quit cold turkey or what's going to happen now? I said, tell me what you've done over the past year to adjust your lifestyle so that when you go off of this, you're not going to gain all of your weight back. Tell me what you've adjusted. And he said, well, basically nothing. I just eat less. I said, so you're still eating the same foods and living the same life that got you to the top weight, the weight that you weren't happy with in the first place. So yeah, if you go off of this now, you are going to gain all your weight back. Nothing's changed. You didn't change anything. So there's quite a few things that we have to look at. The things I mentioned before, is this a perimenopausal women and we can optimize hormones at the same time? How's your gut health? For me, strength training is a non-negotiable. You have to be strength training 3 times a week. Your resting metabolic rate, meaning the amount of calories that you need just to maintain essential life functions, reduces with weight loss. So the more weight you lose, now your resting metabolic rate goes down. And so in order to maintain that weight loss, you have to eat less and less and less. However, your resting metabolic rate is strongly driven by your lean body mass. So the more muscle you have, the more you can kind of sit and not have to worry about losing, muscle or not eating, taking in less calories. However, I will say that tirzepatide actually, there's a recent study that shows that tirzepatide has a positive effect on drastically reducing metabolic rate reduction. So meaning that, yes, your metabolic rate is going to go down, but you don't have a huge drop to where you're in starvation mode. So, lifestyle factors, we're talking about protein intake. You have to have 1.5 to 2 grams per kilogram of body weight. Protein has to be essential. The problem is people don't feel like eating on these super high doses. So I'm working on finding a balance between appetite suppression, quieting the food noise, quieting the cravings without completely wiping out someone's appetite to where they're not wanting to eat at all. That's not acceptable for me. You've got to get in the protein. You've got to be strength training. You have to be using targeted supplementation. By that, I mean nutraceuticals that we have defined based on your biomarkers in a robust blood panel. What does your body need? What's your vitamin D level? Are you on some sort of comprehensive, multivitamin, multi-nutrient to support mitochondrial function? That's important. Also, how is your sleep? If you're not prioritizing sleep, oh my goodness. I mean, if your circadian rhythm is off and you're waking up in the middle of the night or you can't go to sleep, that's a problem for weight loss too. Fiber is another essential, critical component of the entire plan. I need you eating 40 grams of fiber a day. So, this is all part of addressing the whole person. Sometimes we need to do a gut zoomer, a really, really comprehensive look at what your gut looks like. What's your, is there any pathogen in place? Infection, virus, fungus, parasite. What does your microbiome look like? Are you absorbing nutrients from the foods that you're eating? What's causing you to hold on to that fat that your body's just not letting go of?
Yeah, obviously you do such a comprehensive on your patients. And I feel like, from just talking to clients of mine and, friends, family, so often this is not happening, right? People are going in and receiving GLP-1s, even from their conventional doc, like, oh, let's try this. You have high blood pressure, you qualify, right? You can get this drug and, find someone to give it to you and you can take it every week and then come back in 8 weeks. I mean, it's so much more complex than that. And I think it's a wonder how it can, you want people to have the benefit from GLP-1s, right? If you can get them. And I don't think people are getting all the benefits, if you will.
So right. In the traditional medicine world, those providers, although they have good intentions and, the people that are going to be able to receive the prescribed Mounjaro or Zepbound for type 2 diabetes or for obesity, oh my gosh, I would love every patient, their insurance to cover it. And the reality is that they're not, in traditional medicine providers, with all good intention, they don't have the capacity to hold people's hand through this process. And then they're just giving themselves shots and, not really understanding and getting everything that we just talked about. Even me, I see my patients that are on GLP-1 once every 4 weeks for 15 minutes. That's never enough time to talk about the whole plan. So I feel like even I'm missing the mark sometimes. And so I'm working on developing a program that includes continuous glucose monitoring, that includes in-body scanning. I actually just ordered one, signed the papers yesterday. So I'm getting an in-body 580 that looks at so many, I don't want to call them biomarkers, but, body analyzes body composition. So we can really use that comparatively. Muscle mass, bone health for perimenopausal women is huge. I mean, I could talk about that on a whole other podcast. We are missing the mark terribly.
Yeah.
We are not using any sort of screening device except for a DEXA scan. And our doctors don't even bring it up to us until we're 60. Well, by then it's too late. What are we waiting for? So I've recently partnered with Mike Bowie, who is the owner of 2 OsteoStrong locations. We are bringing in a life-changing device that is an ultrasound that looks at bone mineral density, bone quality, overall bone health, fragility score, risk of fracture, muscle mass score. So we need to have that information before we start losing estrogen. So I want to combine, all of those components along with nutritional guidance for a really comprehensive metabolic plan.
That's very exciting for all
Yes.
for all your patients and people that know of you and understand it. Because I do think there's a lack of understanding around functional medicine, right? What is it? How you access it? And that could be a whole other discussion on another day. So just to get back to like some of the common myths or misconceptions about GLP-1s, especially for women in midlife. I think that, there was a recent, if people are on social media, they would have seen it. If you follow some of the influencers, or not even, the docs that are out there and nurses out there trying to spread the wealth of all the things that we can do to support women in midlife. But one of the studies came out that said, if you're on HRT or you're on hormone replacement and you're on GLP-1, you'll have greatest success with the GLP-1. Have you seen that or?
Yeah, I'm so glad you brought that up because, perimenopausal, menopausal women are really where I find my joy. So when when somebody establishes care with me, I do a really robust lab panel that looks at biomarkers of metabolic health, of longevity, of thyroid function, of inflammation, and some nutrient markers, much, much more than a traditional medicine provider would do. The same 4 labs and you're fine. So when I see a perimenopausal woman that has insulin resistance, which is a very, very common side effect of menopause, I know that woman is going to be really successful on. So I tend to lean into tirzepatide. I rarely use semaglutide, but tirzepatide is that dual action peptide. So they're losing estrogen, so we're causing all kinds of side effects by that rapid progesterone estrogen decline. So I'm working on optimizing, replenishing hormones with them. We get lab work. I see that their insulin level is climbing up and up and up. If your insulin level is over 10, you're storing fat. This is your body working against you. If I see a fasting glucose that's elevated, often a hemoglobin A1C that's elevated, insulin that's elevated, oh my goodness. I mean, it's not your fault that you're holding on to fat. We're looking at this as a tool, just a tool in your superhero tool belt to help you get some of the weight off while we're optimizing hormones and doing all of those other things that we talked about. Yeah. And I think, when it comes to myths too, this is so much more. And I've just described this is so much more than just calories in, calories out. People that say, oh, just eat less and move more, don't understand the mechanisms behind how these work and how weight loss works. It's so much more. There is not a one size fits all approach to this. GLP-1s actually improve insulin signaling, which is why perimenopausal women with insulin resistance actually do have success, because there's so many other mechanisms that are happening.
Yeah. Yeah, I love that you said the word toolbox because Angie and I, a lot of times we talk about it takes a village, but we've also talked
Yes.
about like all the tools that you need in your toolbox to get through midlife. And like
Yes.
you said, this is a tool. There's a
This is,
lot of different tools.
Yes.
This might be the one that's right for you, it might not be right for you. So like this is, I just want to say, we're not saying, oh, everybody should go out and be on GLP-1s and hormones. It's just
Right.
something to think about and be part of that. You did allude to it a little bit when we were talking about lifestyle factors about whether it's a lifetime drug. I think that's another big myth that that it's a lifetime drug. It certainly could be, right? If we don't
Hmm.
make the changes that are needed. And that's, and Angie and I are both health coaches, nurse coaches. And, that's part of what we do with our clients is work them through that. Okay, now what? Right? I'm
Yes.
on a hormone, I'm on a GLP-1 or I'm on hormone replacement. Now what? What do I do? Because I think that a lot of people think that either, like we said, one and done, you're going to get the shot, you're going to lose weight, and you're going to be all better. Or I'm going to go on hormones and look at me, I've got cardiovascular risk is going to decrease and osteoporosis risk is going to decrease. Yes, they're going to decrease. It doesn't nullify them. Right? Like
Right.
people think,
Right.
oh, it's decreased, so I'm good. It's like, wait, it's not nullifying. You still have a risk. You just have a less risk. So
Yes.
just kind of taking that all into perspective, right? Like that we have tools that we can use to make our metabolic health better, to help us lose weight, to help us manage our midlife. But they're all tools. Some things can, maybe hormone replacement or MHT will be lifetime. But talk a little bit about that, like these lifetime drug concept and how you manage that with your patients on, do you want to be on this and come and see me once a month, every month for the rest of your life? Or do you want
Yeah.
to, can they get off of it?
Right, right. Yeah, that is, what's the end game here? Now, when
Right.
it comes to HRT, yes, I will be on my hormone replenishment therapy until the day I die, because the day I stop it means that I'm increasing my risk for dementia, osteoporosis, heart disease, a whole slew of other things. So that is
Right.
a lifetime. I don't want to be 80 years old in a wheelchair wearing a diaper riding away. Now, when it comes to GLP-1, I think there's a lot of different approaches. If somebody is on it strictly for weight loss, when they get to their weight loss goal, now we have to take a big look at the whole picture and say, okay, where are we at lifestyle wise? I would never ever just say, okay, you're at your goal, let's stop now. I slowly titrate them down until we're on a tiny, tiny little dose. And sometimes we even stay there for quite a while until they say, okay, quite honestly, I have, um, I'm just now getting to where we're titrating off of a few people. Um, but, even for myself, I'll stay on a 1 milligram of tirzepatide dose because we know that, I mean, so many things about the mechanisms that are happening behind how they work, but they lower inflammation in the brain and throughout the body. They improve metabolic health by increasing fat oxidation. That's how we lose weight. But also, GLP-1s offer neurologic, neurocognitive, cardioprotective effects. They increase AMPK pathway. That's improving mitochondrial health. And, I love to have patients think about themselves from this way. Think about your body in terms of the 30 trillion cells that it is. This is what you're made of. And how are we taking care of each one of those cells and the mitochondria within them? We know that a direct result of aging and losing hormones is mitochondrial insufficiency. They get lazy. They don't want to make energy in the form of ATP like they used to. So what are we doing to optimize that? So that's
I
kind of
feel
a
like,
short answer to
yeah,
my approach to weaning people off.
yeah. But what I always think when I've heard people talk about, is this a lifetime drug? And it's this like, it's this, is that really negative? How often do we talk about, like, if someone's prescribed a high blood pressure medicine or
Right.
they're prescribed insulin, another hormone, right? Like, we don't, I mean, diabetes, that's a whole, I mean, there can be all types, but like, so I shouldn't go there. But I mean, we don't talk about, okay, we'll be taking this off in, 2 months.
Right.
I mean,
Right.
of course, even when people get to their blood pressure and they're stable at 128 over 78 on their dose of, whatever, we're not taking them off of their blood pressure
Nope.
medicine, right?
No.
It's just interesting to think about that. Like,
Mhm.
why have we gone there and all of a sudden labeled this drug as a lifetime drug when guess what? Many drugs are lifetime
Yes,
drugs. I mean,
that is traditional. Uh-huh.
even supplements, like, I mean, what, just, I mean, all sorts of things that we put into our body, we're going to take for the rest of our lives because they're working for us. I guess, I mean, would you say that that label has become more negative because of the cost of this medicine? Or do you think, I don't, or just based on the weight loss, like because it has like, or it's seen as an easy tool for people, or, how all these different ideas around it. What
Yeah,
would you,
yeah.
yeah.
I think media plays a huge role in this. It's so funny that you say this. This is you're spot on with we're not judging people for staying on blood pressure medicine lifelong or thyroid medicine lifelong or anything else. But I was recently, I love listening to Dr. Tina Moore. I don't know if you listen to her, but she is so wise and knowledgeable in this space. And she just said, it seems like about 2021 is when everyone started thinking it's okay to judge other people for what they're on or not on. Like it's really not anyone's business. But I think because of the way that like you said, these are everywhere. You can't get away from them, and people are profiting. People are using these GLP-1s for profit. People are using them the right way. And unfortunately, it's very hard to find the difference. So the also, if there's some people who look at this from the perspective of we have an obesity problem in America. We know that 88 to 92% of Americans are metabolically unhealthy. And so this is our quick fix is just to put everyone on a GLP-1. Well, sure, there are people that's how they're approaching it. That means you're with the wrong person, if it's just here's your shot and move on kind of thing.
Mm-hmm.
So I think when the bad rap that it's getting are those people looking at it, which absolutely makes sense. And I can understand it. Why are we treating Americans with this injection instead of approaching whole health? So yes, those people will be on it lifelong because they've never fixed what got them there in the first place.
Mm-hmm.
Absolutely. Absolutely. I mean, that's one of the things I stress the most in anything I educate on and with my clients and everything. I mean, like, we talked about lifestyle factors multiple times, but like it's such a huge piece of it, like yes, it is a lifetime drug if you're not going to make the changes. Yeah. I agree with you, Angie, like, well, a lot of things are lifetime drugs, but same thing. If you don't make the changes for your blood pressure medication, you will be on it forever. If you don't make the changes for your diabetes, you will be on it forever. Some people can never get off just because it's just the nature of their metabolic state, no matter what they do. But some people can, and the other piece of it, I think, is also like, if you're severely overweight, right, and you can't exercise because everything, it's just too hard to move your body. Well, once you get on this and you're able to get to that point to go do the exercising, then you can, so it's almost like it's a stepping stone to get to the point to be able to do those things. I also think that way about hormone therapy, right? Some women are suffering so much with their symptoms that they can't get out there and they can't do the weight training they need to do. And they can't do the anti-inflammatory because you just lose so much of your resilience and your willpower. And I don't mean willpower, like willpower to stop yourself from eating, the willpower to just get off the couch some days, right? That you need the hormone therapy to just give you that step up to get to the next step.
Yes, you're 100% right. I love to say that menopause is inevitable, but suffering is optional.
Absolutely. We can 100% agree. There's so many different tools in the toolbox that we can be using. So just give me maybe one piece of advice for the women in midlife, and it can be about hormone therapy, it can be GLPs, or it can just be general. With the women, you have already said, you've been living it, right? And you wanted to help women. So if you had one piece of advice to give women in this kind of stage of our life, what would it be?
Definitely do your research. Don't listen to just me. Don't listen to, just one person, but really do your own research. Now, you really have to be careful where it comes from because there are lots and lots of influencers out there giving misinformation. So it is very, very important on making sure that you find the right people to listen to, especially when it comes to the GLP-1s. I know there's lots of online platforms. There's all kinds of counterfeit crap going around out there. So your sourcing has to be, you have to know where you're getting it from. You have to address whole body health. You have to address gut inflammation, toxic burden, hormones. Walking into a weight loss clinic and picking up your GLP-1 and that's all you do. You're just setting yourself up for, for failure in that way. That would be, do your research. I'll say that when it comes to influencers, kickback, there's this anti-kickback law that providers are not allowed to partner. You can't get a referral fee, anything like that. But this is something I learned from Dr. Tina Moore, is that that's not true for influencers. So you're just going to land on the right person that's going to say the right thing. And you're going to, oh, you know what? I'm just going to go ahead and try this tirzepatide. And you're clicking on their affiliate link. They are telling you, either bashing someone or giving you information because they're trying to sell you a supplement or a service. And you're clicking on their link and they're only telling you what the company that they partnered with wants them to say. They don't know what they're talking about. So just be really, really careful about where you're sourcing your GLP-1 from.
Yeah. And to that, we've already said it, but just do your research. You said it. That's amazing. And what Jen and I, our goal is to just create awareness, bring awareness to people and their, all the options. And the second thing I'd like to say as we're just wrapping up is, like, if you don't have a medical home, find one, because that's where you can at least try to, start to build a relationship with a provider, whether it's in a functional medicine home or traditional medicine home. It's like, find someone that you can work with and start a relationship with. And, and if you want a GLP-1, ask for more, more than just the prescription.
Yeah. Find someone that allows you to be your own advocate and create a partnership, not a dictatorship where you're compliant or non-compliant.
Right.
Yeah, I love that you said about like the research and influencers and that too, because one thing that I know Angie and I have talked about a lot is I like to listen to people who have differing opinions so that I can understand the different points that each person is arguing, right? So I'm going to go out and I'm going to find that person who is totally against it. I'm going to go find that, and I don't mean just anybody like influencer, I mean like a researcher, a doctor that a science-based doctor that I or provider that I trust. And then I want to hear what someone says against it so that I can kind of find that middle ground, because there's always going to be yays and nays, right? Ups and people that are all for it and all people who are totally against it. And that's just of anything, but just finding that information. So I did want to also add, you had mentioned insulin resistance a few times. We do have, the Nurse Coach Duo did do an episode on insulin resistance. So we will put that into the description. And then tell us a little bit about where people can find you so that we can add that to our description as well.
Oh, sure. So I own Westplex Integrative Healthcare. We're in Lake St. Louis. You can find me on Facebook under Westplex Integrative Healthcare, Instagram. The website is Westplex Integrative Healthcare. There's lots of very descriptives on the website, lots of information about all the services that we offer. You even have, there's even a shop there where you can order extensive diagnostic testing. You can order your own continuous glucose monitor. So those are the primary ways.
Great. Yeah. Well, thank you so much, Michelle. We really enjoyed having you. This has been fantastic.
Thank you. This was wonderful.
Awesome. Well, hopefully we can have you back, and definitely go check out the Westplex website. And if you like this episode, please like it and subscribe, and you will get notifications when we drop more in the future. Thank you so much.